Good afternoon. This is Dr. Alex Ehsan with another video. Have you ever been told your blood counts are low, or your bone marrow is lazy or is not working normally, or even have heard myelodysplastic syndrome? They sound quite frightening at first, and many people immediately wonder, do I have leukemia? Am I dying? Why is he asking me about my bone marrow getting slow? And generally speaking, these are questions that I hear almost every day. So I'm going to tell you about John. He's a 72-year-old fisherman who never misses one of his granddaughter's soccer games. And for months, something wasn't right. He was getting tired, and he would typically not feel good, even though he'd have a good night's sleep. And he started feeling different. He would feel exhausted when he went for a walk. Quite often, he noticed that he had plenty of bruises on his arms, and then he talked to his primary care doctor, who told him to stop aspirin, and that really didn't help. And his wife continuously asked, "Are you okay?" Nothing really had changed, and the basic blood work that was done showed that his red blood cell count, or hemoglobin, was lower than usual. His white blood cells were lower, so were his platelets. And at first he thought it's iron deficiency, vitamin deficiency. He started taking chewable prenatal vitamins, and ultimately he was sent to us. We went ahead and gave him some lidocaine in his buttocks, as the dentists do when you go to get your teeth, uh, fixed. And after we did a bone marrow biopsy, we saw that he had some abnormalities in the bone marrow that explained why his cell counts were low, and they weren't developing normally. Uh, Having spoken to him repeatedly about the fact that he really didn't want to do anything too sophisticated, one day he asked me, "Dr. Ehsan, what is myelodysplastic syndrome exactly?" Uh, and I looked at him and I told him, "Well, let's call him MDS. Think of your bone marrow as a factory, and every single day, billions of healthy blood cells, red, white, and platelets," I told him red, white, and purple, are created. In MDS, this factory is still working, but the machinery has become damaged, and many blood cells are produced, yet they never mature properly. Some die before entering the bloodstream, others function poorly, and the result ultimately is low blood count. And the symptoms typically end up being fatigue, because the red blood cell count is down, so that's anemia. Platelets go down, so you start bruising and an occasional bleeding. And white blood cells go down, so you start getting infections. However, this process can go on for years, and really, until you have done a bone marrow biopsy and we have studied the chromosomes, we wouldn't be able to tell you that. We always do a genetic testing looking for special mutations that tell us the diagnosis of myelodysplastic syndrome. And luckily, the medicines have dramatically changed over the years, and in some instances, I haven't had to treat a patient immediately, simply give them medicine to increase their red cells, white cells, and platelets. There are some drugs that are simply used to increase the red blood cells, uh, such as erythropoietin. There is some specific drugs like luspatercept that specifically is for myelodysplastic syndrome, and it helps tremendously. There are a group of drugs called hypomethylating agents and azacitidine or decitabine are a couple of those drugs. And every year we have something new. Stem cell transplantation obviously is something that we offer our much younger patients. And with John, really at first it was just to give him things to increase his platelets and red cells and white cells so he could continue doing what he enjoyed doing. Uh, we were lucky enough to keep him on that regimen for a while, and then ultimately we started giving him more sophisticated medicines. And I had the privilege of seeing him through this and navigate the path of his treatment. The new drugs that we have now for myelodysplastic syndrome have definitely helped many, many patients, and there is definitely a lot of encouragement out there. And if you are my patient getting one of these medicines, you already know that things are getting better for you, and I look forward to seeing you this month. And if you're not, I hope this information, even though limited, has helped you, and I hope you never need to meet me or have to see an oncologist for this. Uh, Other than that, wish you the best of luck, and I hope this has been useful.